Well, hello, I'm Bruce Winzar. I'm Executive Director for Innovation and Digital Services at Bendigo Health, as well as the Regional CIO for the Loddon Valley region. I'm going to take you through a journey of Bendigo Health and our build for a digital hospital and our quest to be a data-driven organisation. Our journey started probably 14 years ago with the allocation of some funding to build a digital hospital and the various components of that, which included a whole range of new technologies and new enablers that we'd never had before, the ability to collect a lot more data, the ability to implement a new way of managing our clinical data through an electronic medical record, and then the ability to integrate that across the region with a whole range of other clinical information systems. So our journey really starts with a digital hospital, and we were funded to build a digital hospital, and that was a huge boon for us in our region. We'd spent $650 million on a hospital. It was totally digital, it was totally real time, and of course that ensured that not only was it a technology play, but it was a play for new models of care and a significant business change within the organisation. And therefore the workforce had to come along and enjoy, I guess, the ride for us, as long as the community and along with all the patients that were engaged throughout the design process. Very important to that was the culmination of the delivery of electronic medical record, and we've been able to bring together disparate digital medical record systems into a fully integrated clinical information system that's underpinned by the electronic medical record. But of course that means that we've got a lot of data, and whilst the data is contained in several clinical systems, there are lots of other pieces of data that are meshed together that is being collected live through the digital hospital, as well as being managed and sent across to other regional hospitals. So to be able to do that, good data governance, good analytics, good visualisation. So what we found was that these 6 themes were the key aspects for us to be able to deliver on our vision of a data-driven organisation and to be able to deliver an electronic medical record throughout the 21 sites of Bendigo Health and throughout the region as we move on the quest for excellent care every time, every person. So the digital real-time hospital is about gathering all of the digital enablement and technologies and putting it into a hospital and having lots of smarts like automated guided vehicles and robotics, Wi-Fi splash in, splash out. We have cloud-based solutions. We use smart workflow through robotic process automation. We collect information from medical devices. We're collecting real-time information from a range of resources like information from our third parties. We have 35 third parties that are connected to our network, and we have over 400 applications that are sharing our network across the Bendigo Health platform. We spend a lot of time using and defining profiles, and we've moved from individual profiles to role-based profiles. So our Active Directory becomes an important aspect, the way that we want to access our systems, access data, have access into the electronic medical record, have access to our physical assets, even to the point of where we want to park and what doors we can come in and out of. Medical device integration provides us with real-time data from the bedside into the electronic medical record. And a lot of that data, as you would be aware, the hundreds and hundreds of devices we have are all gathered, they're all transferred, they're all integrated, and they're stored either in the electronic medical record and in some instances into another data set within our data lake. So we have a hybrid technology, we have cloud solutions, we have on-prem solutions, and we have hosted managed services that InterSystems provide for our track environment. The workforce is an important aspect to any change management, and we see this data-driven organisation as a business change, if you like, more so than a technology change. So there's things like changing a culture of the workforce. We've got to change them to think about now the value of the data as opposed to being in silos and opposed to being in control themselves. Well, this is my data, this is my report. What we're moving towards is the sharing and decentralising of that so as all of the data is available to all the appropriate people based on their role, and that the value is now how do we share the data, and how do we make good decision making from that data. So to ensure that, we've brought the workforce along with us. We've had a range of certification, and within the Australian context, we use the CHIA certification. And that's a course it takes about 100 hours of study. We've got nurses, we've got clinicians, we've even got our legal counsel, CEO, a range of ICT people that have all been certified in health informatics, which provides us with that understanding about data, where data is stored and the value of data, and then how do we actually use that data for good, solid decision making. We also found that whilst there were lots of areas of reporting and data analytics, the trust between the owners of that data was very, very low, and the confidence level of have you actually got the right data was always being asked. So good data governance around this has meant that we have now a process that where data is to be shared, we understand the value of that data, we understand who wants to use the data for decision making, and really it's just been a revelation, I guess, in the way that we want to manage and use data in an organisation like ourselves. Culminating in collection of data and all the data that we have across the organisation is obviously electronic medical record. And from a clinical aspect, we did pretty much a big bang implementation of the electronic medical record. And again, that meant that there was lots of data being collected, lots of data being used, and then how do we actually use that data? And how do we link that data to a range of other systems through integration? So typical examples, we integrated into pathology systems, into radiology systems, we interfaced into drug management systems, various databases at a national level, and we're also integrated into medical devices. And as I mentioned before, medical devices sends a lot of data to be stored either in the EMR or in the data lake. We do have decision support within the electronic medical record, and that decision support is really, really important because we're now focused on single source of truth. And the single source of truth, particularly for allergies and alerts, and the way that we use those throughout the electronic medical record is all now in one place. It's managed by one governance agency. It's managed and sent around via integration into other systems like our real-time food handling system, our menuing system, so as to ensure that the patient is not going to get the wrong meal at the wrong time, given whatever their allergy alert might be. We've also had a range of benefits in terms of quality and safety, and particularly in falls management. Falls management is one of the key areas within the Australian context for certification and accreditation, and we've utilised the EMR and part of the EMR functionality to report via colour coding on different inpatient ward units as to their compliance to falls risk assessment. And this has enabled us through the certification process to be one of the key aspects of the 8 themes for accreditation that we passed in the last 3 months. Data lakes and data access. As I mentioned before, we collect a lot of data. The data can either be an application sending data through reports one-on-one in a silo. It could be a combination of 2 or 3 databases being collected, or it could be a data lake where we have a range of data sets from extracts or APIs, or even using Fire to take data from one system and store the data set into a data lake. This has enabled us to reduce a significant amount of silos. Over 400 applications. We've got now data sets of about a dozen of those key data sets that we would tend to go back to the vendor to ask for additions or deletions to the data extract. It would cost us a fee each time to do that. Well, now we've been able to collect all that data, put in a data set, put in a data lake, and start to use that for visualisation and reporting purposes. This, of course, has made it more sustainable for us, and the cost is quite attractive for us to be able to do that as opposed to going back to third-party external systems all the time. Obviously, a centralised data lake has given us access to research and being able to control where the data for research is being sent and who owns that data, and then, importantly, what happens to that data after the research is finished. We've been able to leverage data from a whole range of other systems across the region. And as I mentioned earlier, I look after 16 other hospitals, and our patient admin systems are now fully integrated, and it's fully integrated into the electronic medical record. So we're now sharing patient demographics into the electronic medical record, and we're being able to do our scheduling in our clinics seamlessly through the integration mechanisms that come with the electronic medical record. We do have a significant opportunity now that we've got data lakes to be able to have innovations in artificial intelligence and machine learning and that high-end modelling, if you like, for a range of clinical indicators. And that's a great opportunity for us, which we wouldn't have been able to have knowing full well that our data and data quality is not as clean as what we would have liked to have had. Data governance is probably the most important aspect of data management, and that's around having the right frameworks, the right standards and the policies in place. It's defining who's going to have the ownership and the responsibility for the management of that data, and then the stewardship and the custodianship of that data through the organisation around who can change it, who can look at it, and who can modify it, etc. It's also around having a data catalogue, and the data catalogue is referencing where the data is stored, as I said before, who can access that data, can the data be linked to other systems, what's the effect when we do change management across all of our systems and one system is to be updated and the other system is not updated, what are the linkages, what's the business impact, and very important to have that knowledge so as we can A, manage any disaster recovery, and B, provide business continuity that says this is the way that we will replay our systems in the event that we need to have good business process continuation. The secure access part of data lakes is important for us, so therefore security and the way that we manage security for data governance is extremely important for us, and therefore the establishment of data management principles around how we want to do cyber and cyber security, and then how do we want to actually use data for the continued combination of our compliance and audits. And just like most organisations, we have internal audits, we have external audits, and forever and a day I'm being asked, where's our data collection policy, where's our data governance, where's the data security? So all of this has been empowered and brought upon us through our digital hospital and through the electronic medical record process. Analytics, of course, is important, and the analytics is moved from batch mode, manual reporting now to self-serve. It's on demand, it's decentralised, so the ownership is now set into a centralised area where you go collect the data, you produce your reports, you visualise what they look like, and from a business perspective, business insights, and from a clinical analytics viewpoint, all the data is now available for through the electronic medical record for enhanced, if you like, analytics. And that visualisation process is important for us because, again, it gives us the ability to look at what research we want to do, and in the future, look at what opportunities are available for advanced artificial intelligence and or machine learning. So what's next for us? What's next is that we really want to treat our data as an asset. I want to have the data being recognised at board level as a key asset on our asset register. That ensures that we'll get adequate funding and recognition and due support for data analysis in the future and also for data governance. I want to be able to commoditise the value of data. I think every time we use data and every time we send data out to the research, we should be getting some money and some value for that. At the moment, our data is given freely. We have no control or minimum control around where it goes and how do we actually get it back, and then how it's spread across the research environment, if you like. And of course, we're now moving outside the four walls of the hospital and we're doing remote patient monitoring. We're doing collection of data on applications. We're collecting data on various devices, remote patient monitoring devices, and transferring that data back into the back end. So that's very important for us now to understand the requirement and collection of data that's outside the four walls, and therefore good data governance is required. And finally, we have initiatives around our startup and accelerator programs, initiatives around co-design, and we're working in partnership with InterSystems to look at where and how we can utilise our data in a more efficient way, and obviously in a way that decision making is made with inside our region and Bendigo Health. So that's our journey. I hope you've enjoyed the commentary, and I hope the next few days go well. Thank you very much.